So now a very important principle. I'm going to put 100% and third. So what's crucial over here? We're going to generalize now the difference between acute leukemia and chronic leukemia. So acute leukemia versus chronic leukemia. Okay, so what are the differences? And I'm going to mention like major ones. But first of all, acute leukemia, it can kill you in 6 to 12 weeks. Okay, so it's very fast. Sometimes it's really very fast, and it takes weeks, so 6 to 12 weeks. Okay. Compared to that, typically, and if I'm going to divide it here on chronic myeloid leukemia and chronic lymphocytic leukemia / SLL, small lymphocytic lymphoma, then typically it takes years. So with CML, if it's untreated, like 5 to 6 years. With CLL, even more, like 10 to 12 years. Okay, yeah, it's much longer. Anyways, so the course of the disease in acute leukemias is very fast. Okay, and typically, remember already M3 type. You've got like 8 types, 0 till 7, M7. So M3 is the most lethal one in terms of time. It can really kill you in a few weeks. Remember, this is promyelocytic leukemia. Okay, and remember, it kills you because this triggers, typically, it triggers disseminated intravascular coagulation. This is in some international tests, so remember that. Especially if you talk about acute leukemias, they want to know N3 typically, okay? So, and we're going to talk about it a bit more later. But anyways, what I want to stress over here, if we have acute leukemias, okay, 1/3 of the patients can have increased leukocytes, okay? Or neutrophils, if it's a myeloid, it doesn't matter. 1/3 can have a normal levels, and 1/3 can even have a lower leukocytes. Okay, so normal and higher. Okay, but what is important, it's not leukocytes, but as we said, the acute leukemias are defined by increase of lymphoblasts or myeloblasts, so of blasts. And this is important. So if you have more than 20% of blasts, you can have 30 or even more, that means that the other lineages in the bone marrow are, let's say, pushed out or there's not place for them. So typically, if we have acute leukemias, they are pancytopenias. That's important. So typically, if you would imagine acute leukemias, you should imagine that the person, although there is some huge production of blasts going on, the function of the bone marrow is bad. So typically you will have anemia. So the patient's going to be tired. Okay, you're going to have thrombocytopenia, decreased thrombocytes, or there's going to be bleeding, typical, and this is why they can die. And also, although maybe there are lots of blasts, the function of the leukocytes is low, so they're going to be infections. Okay, so basically, decreased leukocytes, typical neutrophils or functional neutrophils, so infection. Okay, infections. Okay. So the bone marrow is not working, and you're having pancytopenia. This is why, and they die on infection or on bleeding. If it's someone with let's say angina pectoris or whatever, and you have anemia, they can die on heart attack if they're cardiacs. Okay. Another very general thing is that, of course, it depends how fast it is and how the big production and turnover of the blast is over there and how much this gets to the bloodstream. But typically in acute leukemias, you have some level of hepatosplenomegaly. Okay, so the spleen and the liver are typically enlarged. Yeah, of course, if we would talk about what's more commonly, it's the spleen, but yeah, you got a certain level of that. If we compare to the chronic leukemias, they go very slow, and typically the cells over there mature. They are much more mature. Okay, and what does that mean? Well, they function. So, for example, in CML, you can have lots of neutrophils. You will have lots of them. And the same with CLL, you're going to have lots of lymphocytes. So if you look on the differential, they're going to be increased leukocytes, but they are still working. They have some kind of function. So at the beginning of these diseases, you are pretty fine. You have enough of blood elements, you have enough of platelets, you have enough of erythrocytes, and you have high levels of leukocytes, but they're functioning. So you are protected, okay? So at the beginning of the diseases, in the early stages, you don't have any problems. And that is so typical for CLL. We're going to talk about it next time, where typically in a stage 0, you just watch the levels increased. You don't do any therapy, they're totally fine. And yeah, CLL lasts very long. And typically what do we say? It starts late in the years. It starts like when you're 70. So typically people die on different diseases than on CLL. Okay, that's very typical. Of course, the last stage of the CLL is the one that has thrombocytopenia. So in this case, you could bleed and whatever, but it takes years to get to this phase. And remember, typically is the B type, B-CLL. It's much, much, much more common than a T. There are really exceptions to have a T-CLL, but they exist. But remember, if we talk about CLL, it's B. Those are B lymphocytes. They're pretty high. So yeah, we got some pattern over here. With acute leukemias, you got typically pancytopenia, it's very acute, and you got bleeding, you got anemia, you got infection, typically atypical infection. You can have like fungus or whatever, atypical infections. In terms of chronic leukemia, and I should still put C over here, at the beginning it's totally fine, okay? It's totally fine, the lines function, and you don't have any problems at the beginning. Well, with CML, it goes a bit faster. But in both of these cases, especially you have splenomegaly, and a really huge one because it takes years. But with CLL, it's at the end. The splenomegaly comes after years. It takes years to develop, okay, or many, many, many months. So, of course, you got a splenomegaly. You can have also hepatosplenomegaly, but the spleen is always bigger, or it's more common. And the one you should really remember that has really huge, huge, huge spleen. And I mean, in CLL, we talk about years to get there, whether years or many months. But with CML, it can take sometimes weeks or months. So that's much faster. And that is so typical. You have a really, really, really huge spleen. Okay, that's also in tests. Splenomegaly, very huge. It is so huge that, for example, I mean, it's so huge that it compresses the stomach. So in case you eat, you are not hungry at all, you just eat a bit because you think you have a full stomach. Okay, it is so huge. So with CML especially, it can be pretty early, the splenomegaly. And I mean, if someone asks you where's the biggest spleen, remember CML, okay? Yeah, chronic myeloid leukemia, okay? So these were some general principles, and let's get to next point, okay? So next one is typing of different. So thanks for watching, and don't forget to subscribe and ring that bell. And as always, check the description below for supplementary questions and other materials.